Hello, I'm Jessica Samuels, and welcome to A Way Forward, presented by Beam Credit Union. I'd like to acknowledge this podcast takes place on the ancestral, traditional, and unceded lands of the Okanagan Silex people. Today, CEO for CMHA Kelowna, Mike Gawliuk, and I are going to talk about managing your mental health. We're going to share some practices and some everyday things that you can do to help support your mental health, but we're also going to talk about why they help. Mike, this episode is all about the things that we can do to help ourselves feel better. And some of this may be points or ideas or actions that people already know about, but also they might be things that make people feel better and they don't know why it's making them feel better. And so we want to dig into a little bit that and hopefully give some ideas and tools in the toolbox for folks to better manage their well-being. I think off the top, though, I do want to spend a bit of time in talking about the difference when we say talking about managing your mental health and managing your mental illness.
Yeah, I think, off the top, when people talk about mental health, I think that's oftentimes confused with mental illness, and not necessarily clear on a definition. And mental health is like physical health. We all have it. It's a thing we all possess. Whereas a mental illness is a diagnosable condition that impacts our mood, behavior, thoughts. And so they're two different things. And if you consider mental health as something everybody has, and we look at circumstances, it's on a continuum. So we have mental health and we can flourish or we can languish with mental health. And that depends on what's going on in our world, right? So if I have a really, really tough, stressful week, I'm experiencing mental health, but I'm languishing a little bit. I don't have a mental illness per se. I'm just having a really tough week. And I'm, probably need to do some of the things that we're going to talk about later to help myself. On the same level, if you look at mental illness, just because someone is diagnosed with a mental illness doesn't mean that their mental health isn't flourishing. It could be that they're, going to therapy, taking their medication, doing all the things that they need to do to take care of themselves. And so for me, that's the distinction. Everybody has mental health. Not everybody has a mental illness. Ultimately, we can flourish with a mental illness or without.
Right. And I do like repeating that. And one of the things that I appreciate about this is that I think it drives home the point that you have to take care of your mental health. I think some folks may think whether or not they have a mental illness, just mental health is something that happens to you. And that helps to really point the home that you have some control of ways to better your mental health and well manage. And that's really what this episode is about. We like to feel or to give people ways to feel empowered, like they're in control. And maybe in a world where so much is out of our control, let's try and gain some control over how we're feeling about ourselves and the world around us.
For sure. I think it's easy to understand when we put it in the context of physical health, right? We know the things that we need to do and some things we can do to help with our physical health, right? Again, and some overlap. And whether that's, diet and exercise, those kinds of things. It's the same with mental health. It doesn't just happen. And there are things that we can do to ensure that we have positive mental health.
Right.
Yeah.
Okay, we're going to get into those things. And then just one other thing before we get into those things, because this came up in the research and I had a bit of a learning. So there's like this buzz phrase, and I'm going to say it at the risk of like eye roll or maybe cringe, but like it's this self-care piece, right?
Are you talking about bubble baths?
Well, I am, but I'm not, but I am. And I say cringe because I will admit to being like, oh, self-care, like bubble baths, really what's their place in the world? And how is this really going to make people feel better? What I did come to understand is that there's kind of this self-care, self-soothe, push and pull. They both have their place. One does not replace the other, but they both have their place. So let's talk about self-care, the definition of self-care.
Yeah. Well, first of all, self-care, despite your perceptions, is not necessarily self-indulgence or selfish. Yeah. Really what it boils down to, it's about taking care of yourself. It shows your importance and you're worthy. And it's really, how do we take care of our physical, emotional, and environmental health? And on the other hand is self-soothing. And I look at it from the standpoint of sort of self-soothing is sort of what we do right now if we're having a tough time or we have distress, that sort of thing. And it can be a positive activity, or it can be something that might be harmful. And so one of the questions is, if the thing that I do right now makes me feel better, it's likely self-care. If afterwards I feel the same or worse, it's an act of self-soothing.
Okay. I'm just going to spend a bit of time on this, because when we're talking about self-care, and you said it was great and definitely a learning and a reflection for me, it doesn't mean self-indulgence. It doesn't mean you're selfish when we're talking about self-care. But then, I guess part of the problem that I have is, well, then why isn't that just an excuse for me to go over and do whatever the heck I want if it's going to make me feel better, if I think it's going to make me feel better? And that's the line that you're talking about.
Yeah.
If afterwards I feel better, self-care.
Yeah.
If afterwards I don't feel better, I feel worse or the same, not self-care.
Yeah. If as I said, again, I've had a tough week, and at the end of the week, I'm my mental health is on the other side. If I decide to go out and hit the bar and, have a bunch of drinks and get intoxicated, I'm going to feel better in the moment. When I wake up tomorrow, probably not going to feel as good.
Right.
And so that act is really dealing with the situation in the moment. And it has negative consequences. So it's not to say that self-soothing is necessarily good or bad unto itself. It's to say the choices that we make to self-soothe, some can have ramifications that aren't not necessarily very healthy.
Okay. So I'm unclear about the bubble bath. Is that self-care or
Well, let's ask. Are the bubble baths part of like a routine that happen like on a weekly basis?
Oh yeah.
Or
okay.
is it something that happens on an evening because you've just had a day and you just need to get in the tub, light a few candles, and feel better in the moment?
Okay. Okay. See? Okay. I appreciate that. I do want a bubble bath right now.
Yeah. Yeah. Myself as well.
Sold. Done.
Yeah, exactly.
All right. On to some other tips. And before we started this episode, you said to me, shouldn't we just call this Jessica Go Outside? Because as we well know, and I've expressed a few times, I need to go outside and usually have some exercise to go outside to get rid of the angst, anger, stress, low mood.
Yeah.
Not uncommon. Outside, and there's a reason behind it. Yeah. Outside makes us feel good.
This is either the episode where Jessica goes outside and or the episode of things Mike should do more of.
Bubble baths.
So absolutely, being in nature has been shown to have, really positive mental health impacts. And whether that's a matter of, putting your feet in the grass or in the sand, what happens is it allows us to actually be involved in something that's bigger than ourselves. like there's a big world out there. We go hard, and we're on devices all the time, that kind of thing. Getting out there and having those experiences, being able to, listen, whether it's to birds chirping, different sensory experiences, those things that we see really have an impact in terms of reducing our stress hormones and making us feel better. And so it's been proven, certainly scientifically, that getting out into nature is absolutely one thing that you can do that is going to help you to manage your mental health. And we have certainly at CMHA, we have a course called Discovery College. And one of the episodes, I think actually we have two now, are specifically around mental health and nature. And people, it's online, people can join and certainly participate, and then again take some of the ideas and put those into practice in their own world and their own lives.
Right. And the other part of that as well, being outside, two things I wanted to mention on that. We may have, I've heard instances of doctors prescribing that, the nature prescription. I don't know the scenarios or kind of the full details. And I'm sure it's part of a gamut of things that are shared, but it goes to speak what you're saying, that it is scientifically proven, as well as, for me, the other part of being outside is exercise.
Yeah.
Like that exercise piece, whatever exercise looks like for you as an individual, also does really good for our mental health.
Yeah, I mean, certainly some of the research on exercise just talks about the release of endorphins, right, which are painkillers and mood boosters. So exercise and exercising is going to release those. So you're going to feel better. Exercise leads to people feeling better during the day, sleeping better at night. Having sharper memories. I need to exercise more. And so exercise is a great way to manage your mental and obviously your physical health.
Okay. Another one that I'm a big fan of, and two examples kind of put together because I think they are tied together, is volunteering and connection, social connection. So those are volunteering supports your mental health, and having connections supports your mental health. And you can talk a bit more about that.
Well, this one comes back into some of what we talked about around loneliness, right? And I think actually one of the themes that has run through a lot of the episodes is that notion of social connection. So volunteering certainly can achieve that social connection that people are looking for, help them to reduce their loneliness, and helping feels good. So volunteering as an activity really addresses both of those things. And when I looked at some of our research and was listening around the episode, people around the pandemic actually started to talk more and more about wanting to volunteer, because again, one of the many things during the pandemic we had to do sort of was a prescription for poor mental health, was again the social isolation and those kinds of things. So that's really where people started to see more talking about volunteerism and opportunities to re-engage and socially connect, right? And so it's a great way to do that and to give back.
And that volunteering piece, exactly, giving back, contributing, feel like you're making a difference,
Yep.
Feeling like you're useful, like you have some kind of purpose. And that again ties into, kind of that loneliness. Perhaps if you're an individual who doesn't have family members close to you, or you're the surviving family member, feeling like there's a purpose to why you are here. And so those are some really tangible reasons why volunteering and then leading to connection support our mental health. Also having a pet. This is probably not going to be a surprise to some folks because, you ever bring a puppy into an office or dogs into care homes, there's that feel good moment. But the reason I want to bring it up is because it is actually determined to be something that actively supports your mental health.
Mm-hmm. Well, first, I'd be remiss if I didn't mention Foundry. And when we first opened Foundry, one of our generous donors donated Henry, and Henry is the Foundry dog basically, and he's been there from the beginning. And yeah, you can see the impact of Henry in that case, in particular, with youth that are maybe coming in the door for the first time, maybe experiencing anxiety issues. Mm-hmm. Certainly, pets have been shown to have a really positive impact for people that may be experiencing autism or ADHD. The things that pets bring, and some of that is, I mean, when we look at sort of tying some of these things together. Mike has a dog. So Mike's got a companion. Mike needs to get out and walk that dog. So there's an opportunity there to get some exercise. And one of the things actually noted, I'll go back to being outside and being in nature. One study found that 17 minutes a day is enough time in nature to have a meaningful impact on your mental health.
Wow.
So I think my dog Jackson, he's getting a little up there in age. So 17 minutes is probably going to be 2 walks.
Okay.
But it's really, really cool to know that.
Yeah.
And then pets, and obviously I'm biased because I have a dog. They also model and give unconditional love. And how can that feel bad, mm-hmm. right? And so owning a pet has multiple impacts on mental health. And the other thing is mindfulness we talk about. Pets live in the moment. So being in nature, being out with the pet, going for a walk and sniffing around doing their thing, we could learn a thing or two from them, mm-hmm. in terms of being mindful, right. And maybe being mindful along the way.
Pets can be a lot of responsibility and they can be onerous and expensive. So not everybody can own a pet. And that's why volunteering with pets or volunteering for organizations that look after pets can also be a way of the volunteering, the pet connection, and also making connections in the community. So once again, you kind of have a trifecta there of supporting your mental health.
Yeah, bringing it all together.
Right.
Now, I wanted to flip it to you because I know you identified these as a couple of your go-tos.
Oh.
And so here's my chance to ask you a little bit
okay.
about these two. Kindness and gratitude, mm-hmm. and how they impact on people's mental health.
Yeah. Well, I mean, so first of all, there's the research and there's the findings. You've got all the good stuff that we've mentioned earlier in this conversation. You've got the serotonin uplift. You've got the endorphins. You've got the dopamine that not only you experience in your body when you are practicing kindness or gratitude, but I can only imagine for the person who's receiving it also, you hear about that pay it forward. There's that part of your paying forward. And for me personally, I really think that after pandemic, just really making an effort, I have really made an effort to go out of my way to show kindness and gratitude. I think from my personal experience and what I witnessed, I feel like there's a lot of frustration. People were uncertainty. We all didn't know what was going on. And that has carried over. And we've mentioned that a few times mm-hmm. on this podcast. So to put it simply, I feel like people are really freaking angry out there mm-hmm. And short with people in the world. Yeah. And I make it my mission to just take a beat, give people some grace, and act with kindness and gratitude. Sometimes it's harder than others. Yeah. Then I feel good. I feel better. I feel I haven't gotten that fight or flight mode going on in myself. I feel like I've done the person a kindness because I don't know what's going on in their world. I don't know what they've dealt with before they've come to me or what they have to go back to. And so even before I knew the science behind it, this was something that I actively and continue to actively try and practice. And I think it does really good things for my mental health and hopefully for the people that I pay it forward to.
Absolutely. I mean, your experience is backed up by some of the research that we looked at. A lot of times we talk about stats, mortality comes up. There was one study actually where they identified that people who practice gratitude have increased mortality by 9%. I don't know how they measured it, but it actually has that much of an impact on the individual. When it comes to kindness, another study that I listened to was about looking at 3 groups of people that had mild to moderate anxiety and depression. And it was a research study, and one of the groups was to engage in acts of kindness. One of the groups was encouraged to engage in fun activities twice during a week. And this harkens back to our counseling episode. The other group was provided with cognitive behavioral therapy. And then they measured the impact of all 3 of those. And they actually identified that the one that had the most impact for the participants was the acts of kindness. And that's huge and super meaningful. There's no doubt about that.
Yeah. Well, I'm glad it's backed by science, and if I can't be gracious or kind, that's when I go for the walk outside with my dog.
Deal.
Right. Okay, Mike, thanks. This was a fun one. I appreciate it, and I hope folks appreciate it too.
Thank you.
Okay, so we're going to have all of those tips on the A Way Forward podcast page presented by Beam Credit Union. Of course, that is on CMHA-Kelowna.org. And just remember, as you go forward, be gracious, be kind, and as always, please do take good care. Beam Credit Union supports mental health initiatives across British Columbia because caring for each other builds stronger, more connected communities. United as one, Beam's founding credit unions now serve 190,000 members across BC.